What is consolidation on a TB chest X-ray? Imagine looking at a chest X-ray and seeing a solid, cloudy patch in the lung that wasn't there before. That's what doctors call consolidation. It happens when the tiny air sacs in the lungs, called alveoli, fill up with substances like fluid, pus, blood, or cells instead of air. This makes that part of the lung appear denser or whiter on the X-ray. The normal lung tissue, which is usually dark because it's filled with air, becomes more opaque. This change can hide the usual lung structures, including blood vessels, making the area look more solid. In tuberculosis, or TB, consolidation is a common sign of lung infection. When TB bacteria infect the lungs, the immune system responds by sending cells to fight the bacteria. This causes the alveoli to fill with immune cells and other material, leading to consolidation. Usually, this appears as a dense, uniform area on the X-ray. It can happen in any part of the lung but is often seen in the upper lobes, which are more commonly affected in TB. Sometimes, the consolidation looks patchy or irregular, especially in more advanced or active disease. One characteristic feature of consolidation on a chest X-ray is the presence of air bronchograms. These are dark lines that representing air-filled bronchi visible against the white, consolidated tissue. They indicate that the airways are still open despite the surrounding filling material. Consolidation in TB may also be associated with enlarged lymph nodes in the chest area, known as lymphadenopathy, especially in primary TB cases. And like lung collapse, consolidation usually does not cause the lung to shrink significantly. In some cases, TB-related consolidation can progress to form cavities. Cavitation occurs when the infected tissue breaks down, creating an air-filled space within the lung. This is often a sign of active and contagious TB. The consolidation itself can be persistent or recurrent, and its pattern, location, and associated features help doctors determine whether TB is likely or if further tests are needed. It's important to remember that consolidation on a chest X-ray isn't exclusive to TB. It can also be caused by bacterial pneumonia, lung infections, or other inflammatory conditions. That's why doctors consider the patient's symptoms, history, and additional tests like sputum analysis or cultures to confirm TB. The presence of consolidation is a clue, but not a definitive diagnosis on its own. In summary, consolidation on a TB chest X-ray is a sign that part of the lung is filled with infection-related material, making it look whiter and denser. It often appears in the upper parts of the lungs and may be accompanied by other features like lymph node enlargement or cavitation. Recognizing these signs helps healthcare providers evaluate the extent and activity of TB and plan appropriate treatment. If you or someone you know has a chest X-ray showing consolidation, it's essential to consult a healthcare professional for further testing and personalized care.